Okay. Take a screenshot and keep with you. So we will discuss later. Okay. So we will start the class, and in between, if you feel any sound disturbances, let me know. All right. Okay. So we will move on to the role play, and here in this candidate cue card, first they had given the setting as a hospital ward and nurse. You are speaking to a 50-year-old man or woman who is scheduled to undergo colostomy in your hospital day after tomorrow. So you're speaking to a person who is scheduled to undergo a colostomy in your hospital day after tomorrow. He or she has never had surgery in her life. So that's very important that she or he has never had a surgery in her life and seems anxious about the operation and its effect on life at home. So she is anxious about the operation and its effect on life at home. So we know it's a colostomy surgery. So of course after surgery she will have a colostomy bag and stomach care should be there and back care. Everything has to be there. So of course she will be very anxious. So we need to explain everything, right? So we will move on to the task. On this cue card, they had given 5 tasks. The first one, find out about his or her concerns and empathize with the patient. So we need to find out her concerns and we need to empathize her. Okay. And the second one, when asked, explain that the surgery will be performed under anesthesia and will not be painful. So, of course, she might have a fear of pain. So, when she asks, we need to explain that the surgery will be performed under anesthesia and it will not be painful. All right. And the third task, outline the management plan to support the patient at home after surgery. So we need to outline the management plan to the patient and how she or he can take care in the home after surgery. So it includes discharge instructions by stoma nurse about care, equipment, diet after surgery. So it should include discharge instructions by stoma nurse about care, equipment, diet after surgery. Okay. And the fourth task, reassure the patient that the surgery will not prevent his or her participation in any social activities. So we need to reassure the patient that the surgery will not prevent his or her participation in any social activities. So it means the patient is having anxious regarding the participation in social activities or how other people will see her or him. Okay, so it should include support by the GP and district nurses to enhance patient's recovery during adjustment phase. Okay, so we need to tell the patient regarding the support by the GP and district nurse to enhance patient's recovery during adjustment phase. So it means, of course, she can go back to the social activities, but it will take time. So that's the adjustment phase she has to overcome. All right. And the last task, we need to offer to schedule a meeting with the stoma care nurse tomorrow. So that will be the last task we need to offer to schedule a meeting with the stoma care nurse tomorrow. All right.